Hi, I'm Haley Selleck, nurse practitioner at First Responder Health and Wellness. And in today's 5 Minutes to Better Health, we're talking all about peptides, what they are, how they support healing, and why they're not a magic fix if your foundation isn't in place. So let's dive in. So, what are peptides? Peptides are short chains of amino acids, and they act as a signaling molecule in the body. So, think of them as messengers. They tell your body when to repair, when to reduce inflammation, and when to start regenerating tissue. So, different peptides have different roles. Some support recovery and healing, others improve sleep, immune function, or even our metabolic health. Peptides help with inflammation and healing, and one of the biggest benefits of them is really to be able to modulate this inflammation in the body. And instead of just suppressing symptoms, peptides can really help regulate the immune response and bringing the body back into balance. And this is especially important for first responders who are, or anyone under chronic stress, where inflammation tends to stay elevated. And certain peptides can also accelerate tissue repair, help with muscle recovery, joint health, gut lining repair, and even brain health. The risks, though, that you need to know, because there are some of them, and this often can get overlooked. So, peptides promote growth and repair. So, if there's something in the body that you don't want growing, like an undiagnosed cancer, these same pathways can potentially stimulate that as well. And that doesn't mean that peptides cause cancer, but they may accelerate that existing abnormal cell growth. And this is why proper screening, medical oversight, and really individualized care really matters with using peptides. The other thing is another major concern in my mind is that we need to know where these peptides are coming from. And right now, many peptides are sourced from research grade companies, and they're not regulated for human use. So that introduces this risk of purity, dosing accuracy, and ultimately contamination. So the future and what's moving forward is very exciting with peptides. It's going to hopefully be safer to access through a compounding pharmacy with this third-party testing and medical oversight, which is really where this space needs to go. But the biggest mistake that I see is skipping the foundation. So here's the reality that peptides are really not a shortcut. And if your sleep is poor, if your nutrition is off, if your stress is unmanaged, and your metabolic health is not optimized, peptides will have very limited effectiveness. And so your body has to be in a state where it can heal in order for these peptides to be effective. So that means that having some stable blood sugars and preventing, this insulin spike, adequate protein, and optimal micronutrients is really key when utilizing peptides. Consistent sleep is another huge factor. Nervous system regulation. So if cortisol is completely dysregulated, peptides will not be near as effective. And so without that foundation, you're really trying to build on this unstable ground. And so peptides can really be a powerful tool, but they're exactly that. They're a tool, and they work best when layered on top of solid lifestyle habits and used with the right guidance and the right sourcing and ultimately the right patient. So if you focus on the foundation first, that's when you really unlock their full potential.